Hello there. Today we will discuss on the AML, that is acute myeloblastic leukemia. So here the treatment you require is the induction therapy. To continue the induction therapy, we need to have BSA, that is the body surface area. The formula you require for the BSA is under root height in centimeters multiplied with the weight in kg to be divided by 3600. This 3600 is the constant number. It is always there. So here, like example, if your patient is having the weight of 57 kg and the height is in the 159 centimeters. So how you are going to apply in the formula? 57 kg to be multiplied with 159 centimeters whole divided by 3600. So when you will get the BSA after complete calculations is 1.58 meters square. So 1.58 meters square is the BSA, body surface area of your patient. So the first drug in the induction therapy is daunorubicin. Daunorubicin, the doctor's order is 60 mg per meter square. So how you are going to do this? 60 mg is the doctor's order that to be given based on the BSA. So the BSA of your patient you have got from the previous calculation of BSA is 1.58. So here you are going to multiply 60 mg of the drug dosage with BSA 1.5. You will get 94 mg. So 94 mg to be added in 250 ml IV. How much the time duration you will be giving is over 30 minutes on day 1, 2 and 3. So only for 3 days you will be giving for 30 minutes this dosage for your patient. Here need to mention the start date and the end date. Like example, if 10th of December we are starting, 10, 11, 12, 13 till the 12th December you will be giving to your patient, so just for 3 days. So that what is the action of daunorubicin is the action chemo treatment for the cancer patients or like a chemotherapy. So indications is acute myeloid leukemia, acute lymphoblastic leukemia, chronic myelogenous leukemia and Kaposis sarcoma is the indications for daunorubicin. So coming to the class of medication, this comes under the anthracyclines. So anthracyclines will slow the growth of the cells. What is the antidote of daunorubicin in case if sometimes the patient have undergone with extravasation, means fluid shift in the surrounding tissues, then in that case we give cold compressions to the patient with the help of ice packs or we can keep the ice pack on it on the affected area and give cold compressions. Coming to the nursing interventions for daunorubicin medication is interventions. Check the heart rate of the patient before administering ECG. We need to check the ECG rate, rhythm and the blood pressure during exercises, especially monitoring the signs of leukopenia, fever, sore throat and signs of infections to be checked in the case of daunorubicin. Then is the next medication, as we have said that it's induction chemotherapy, right? So we will have more than one medication for the patients with acute myeloblastic leukemia. So next medication is the cytarabine. Cytarabine doctor order is to give 100 mg per meter square. So when you are having the BSA of it's per meter square, that is the BSA, right? So what the BSA you have got from your calculation is 1.58 meter square for your patient BSA, and the drug order is 100 mg. So you will be multiplying BSA body surface area with 100 mg of the doctor orders, and then you will have like on hand to be given to patient is 159 mg. So this 159 mg to be added with 250 ml of D5W continuous IV infusion we will be giving for over 24 hours daily, 1 to 7 days. So previously daunorubicin is given just for half an hour and 1 to 3 days only, whereas here 1 to 7 days. So then the starting date and the end date also need to be mentioned. What is the action of cytarabine? Action is to stop the growth of the cancer cells in the body. What is the class of drugs? This is anti-metabolites. Okay, anti-metabolites. Whereas the donorubicin was your class of medication anthracyclines. That was the anthracyclines, which helps in slowing the growth of the cells. That was donorubicin. Okay, whereas cytarabine, the medication here, anti-metabolites. So this anti-neoplastic, purine, antagonist, immunosuppressants. So this is the main class of medication, cytarabine. What are the routes we can give this medication? Is intravenous route, subcutaneous route, intrathecal. We know IV and subcu is much more common. But in the chemotherapy, intrathecally is usually used root side. Intrathecal is in the spinal cord. We give directly intrathecal. Then coming to the nursing intervention, in case of cytarabine, inspect patient's mouth for toxicity, lab test HCT and platelet count and total and differential leukocyte count to be checked daily. Serum uric acid and hepatic function tested regular basis, because cytarabine or any chemotherapy medications will increase the uric acid level, means urea will get increase in the blood. So you need to also monitor the serum uric acid and hepatic function on regular intervals. Then hyperuricemia due to rapid destructions of the neoplastic cells. As I said, it will be causing like urea high in the body, blood, urine. So you need to check because of rapid destructions of the neoplastic cells. Monitor intake output chart strictly. Body temperature need to be assessed, platelets, because sometimes the patients may undergo thrombocytopenia. It may starts with the bleeding from the nose or from the urine or from the wound sites. So need to check the platelet count also. Provide good oral hygiene to prevent super infections, because this type of medications will cause stomatitis, and chelosis usually appear 5 to 10 days by following the therapy. So here, as the patient is going to affect with the infections or inflammation in the mouth, we need to provide oral hygiene as well as mouth to be kept very clean and tidy, because the patients as they are going to have infections and the main source of eating food, consuming food, is the mouth, and that causes more irritation to the patient. Next is the medication allopurinol. Allopurinol is actually not the chemotherapy medication, but this is xanthine oxide class of derivatives drug we give in order to prevent the complications of chemotherapy medications. Okay, from the start of chemotherapy, we will be also giving with allopurinol. It is to decrease the blood uric acid levels. The indications is to prevent gout, because the uric acid usually accumulates at the sites of joints and causes gout disease to the patient. Then the renal calculi, because of the excess of urea in the urine, also causes renal calculi, and high uric acid occurs with the chemotherapy medication. So to prevent that complication, allopurinol we are giving. So what is the nursing interventions in this case? Is monitor the signs of hypersensitivity reaction, including pulmonary symptoms, tightness in the throat and chest, wheezing, cough, dyspnea, skin reactions such as the rashes, pruritus, urticaria, and notify any signs of hypersensitivity, because the patient will become very sensitive to other type of drugs because of the stomatitis. As in the cytarabine, we see that we need to follow with the stomatitis by providing oral hygiene. So the patient will become very sensitive. Encouraged to drink fluids, 8 to 10 glasses of water. Take medications after meals to prevent the stomach upsets, especially because by following with the meals, the medications will be affecting little slower and it gets mixed with the other fluid content, foods in the stomach, and it will prevent the stomach upsets. What the route we can give for the allopurinol? allopurinol medication is oral. If patient is not able to tolerate, then IV can be given in order to prevent the tumor lysis syndrome. Okay, so allopurinol or orally if the patient is tolerating, or if patient is not tolerating, and to prevent the tumor syndrome, we can give IV for management of the chemotherapy. Hope this is clear. The next medication what we give is omeprazole. So omeprazole medication is 20 mg per oral OD. If patient cannot tolerate oral, then switch to 50 mg IV if every 8 hourly or specified by the chemotherapist. So omeprazole is a proton pump inhibitor. In order to treat the heartburns we give by reducing the acid in the stomach, this medication actually acts. So omeprazole, as it is a proton pump inhibitor, it need to be given little slower to the patient. Very fast rapid push we cannot give. Always remember to dilute this medication and give in the normal saline for the patient at least 50 to 100 ml, because this type of medications will cause like sudden heart arrest to the patient. These are the cases what we have seen at the emergency department side for the patient. So remember, always omeprazole or any of the proton pump inhibitors need to be diluted, then give to the patient little in the slow time, like 30 minutes, more than 15 minutes need to be given. Okay, so just dilute and give. What is the nursing interventions? What you need to take care is avoid acid food to the patient. Encourage the patient to avoid acidic food, apples, lemon, grapefruit. It stimulates the GERD, gastroesophageal reflux disease, this type of foods, okay, acidic foods. As well as avoid alcohol and foods that may cause an increased GI irritation. The foods, like example, high fatty foods or junk foods which will be increasing GI irritation, these foods to be avoided. Instruct patient to report prolonged side effects including the skin problems. If they are feeling like itching, rashes, encourage the patient to speak up and inform to you prior, so that we can start with the other treatment. Proper administration is for the omeprazole or proton pump inhibitor or any medications which helps in reducing the acidic content need to be given before meals, at least 30 minutes before meals. For its therapeutic effectiveness, we need to give prior the meals, at least 15 to 30 minutes before meals. Okay, advise to drink plenty of water to the patient, so that this all medications can get good digested and it will not cause any further problems to the patient. So what are the medications we give in the induction therapy for the patient is Jonorubicin, cytarabine, omeprazole, allopurinol. First of all, the rubicin is class of anthracyclic medications. Your cytarabine medication is antimetabolites medication. Your allopurinol is xanthine oxide class of drug. And omeprazole is your proton pump inhibitor. So these are the 4 medications what we give in the case of your AML, acute myeloblastic leukemia. So thank you, take care. I hope it is little clear to you. Please like, share and subscribe if you really like my video. Thank you so much.